So in this question, we have 43-year-old woman which is bitten by a spider while cleaning her old garden shack. In the hours after the bite, the woman is most likely to develop which of the following? Fruit-like odor at the bite site, coagulative necrosis, liquefactive necrosis, extracellular haline deposition, caseous necrosis, calcification over the bite site. So to answer this question, we first have to discuss what is necrosis. It is the cell death after exogenous injury. The exogenous injury is important because the cell death which is caused by endogenous injury is apoptosis. The necrosis have four distinct morphological patterns. Coagulative necrosis, it is most common. In this, there is preservation of cell outline in the necrotic tissue. You can see if the outline is this, the necrosis will occur within this cell outline. The examples are spider bite, as we have in this question, organ ischemia, as myocardium in the heart or kidney. In this necrosis, the cytoplasm become eosinophilic due to protein degeneration. It has three distinct stages. You can say the nucleus shrink first and the chromatin clump. This stage is called pycnosis, then followed by fragmentation, which is called karyorrhexis, and then lysis. So these three stages are very important to remember. Next is liquefactive necrosis. It occurs in the CNS. Important thing to remember. First of all, the ischemic stroke will occur. This will lead to fragmentation, as we discussed previously fragmentation. Then these fragments will be phagocytosed by macrophages and a cystic cavity will form. This is liquefactive necrosis. Fat necrosis, it occurs very importantly in pancreas. When the necrosis occur, pancreatic enzymes come out of the cell. They digest the parenchyma of pancreas. The fatty acid will release. It will combine with the calcium, forming sponification. The whole process is called fat necrosis. The last one is caseous necrosis. It occurs in TB. There are some diseases which also involve caseous necrosis, but they are not here important. So TB. It has cheesy appearance, which will lead to fragmented cells and acellular material. Now we will discuss the option one by one. So fruit-like odor at bite site. Fruit-like odor is associated with the Pseudomonas aeruginosa, which will stain blue-green hue, and this color will form at the wound site, and the stain will also look like this. Option B, coagulative necrosis, is a very high yield option. As we have discussed previously, in coagulative necrosis, the spider bite is the example. And liquefactive necrosis occur in CNS, as we have discussed here. It occurs in CNS, ischemic stroke, fragmentation, eat by macrophages, and then cystic cavity. Extracellular haline deposition. It occurs in hypertensive patients and diabetic patients, and due to accumulation of plasma protein in the arterial wall, and it occurs in the arterial wall especially. So this option is not suitable. Caseous necrosis. It occurs in TB, as we have discussed previously. So this also doesn't match our answer. Calcification over the bite site. It occurs over necrosis. Yes, it occurs over necrosis, seen as white granules. This is seen as white granules, but it developed after months to years of initial injury. This time period is very important to consider when you discuss with the calcification. So I hope you find the correct answer, which is coagulative necrosis.